Today, this healing feeling will be speaking to Amanda from the Pain Care Clinic. And Amanda, please tell me, if you would like to, what you do and how you came to be doing it.
Right. Okay. So I am trained as a massage therapist, and I specialize in myofascial release, which is a slightly different approach to many other therapists. And it works with the fascia, which is the main connective tissue in the body. And for many people who have chronic pain conditions, the issue that they have is that the fascia's got stuck somewhere in the body and is causing pain. In particular, people who have had pain for some time and they've had all the medical tests and they've seen lots of different people, and they're eventually told that there's nothing wrong, they can't see anything wrong, and so they just have to live with it. And actually, quite often it is the fascia, the connective tissue, that's got compromised somewhere. And because it doesn't show up on most diagnostic tests, so things like X-rays and scans, then it looks like there's nothing wrong. So there's nothing structurally wrong with people. But fascia as a tissue is everywhere in the body at every level. It connects in and through everything in the body, and it connects everything together. So it is like a big web network throughout the body. And so everything is encased in it and formed from it and connected to it. So that includes your muscles, your nerves, blood vessels, your bones, your organs, and everything in between. So basically, from a fascial point of view, if you get a snag in that system, which could be a scar or an injury, then that can radiate a restriction or a new line of tension that travels through the body. So it's very common for people to have referred pain patterns. So, for example, somebody might have a restriction in their neck, which actually shows up as some kind of RSI problem in their hand or their wrist. So again, from a medical point of view, if people are just looking at the hand and the wrist and they can't see anything wrong, they don't always tend to look upstream to the neck where the problem is. So anyway, so that's a long-winded way of saying that myofascial release helps to release the restrictions in fascia, and that's basically what the technique is about. And it's both a hands-on technique and a self-help technique that people can use.
Wow, brilliant. That was as exactly what I wanted to know and articulated and just incredibly crisply. And so, I mean, once fascia was described to me a bit like that funny stuff you have on the outside of chicken, like it's almost like sort of elasticated and it kind of encases everything in. And so
Mm-hmm.
what you're saying is that if you've got one of sort of like a compromise, something compromised in, for example, your shoulder,
Mm.
pull and something, so it's another part of your body completely could actually be then hurting or causing you discomfort because it's being, oh my goodness.
And it can happen over time as well. So it doesn't necessarily happen immediately, which is why for a lot of people, there's absolutely no logical connection between something that they happened to their shoulder 5 years ago and hip pain that they've now got. For lots of people, they just don't realize that there's any connection whatsoever. And a lot of people have, particularly when people have had surgery, so pelvic abdominal surgery, for example, so whether it's an appendectomy or whatever, that can create pain that doesn't turn up for several years. And it's because over time, the fascia is gradually growing out along the tension line. So it's like the scar starts in one place, and then the natural lines of tension in your body start to pull the scar tissue out along those lines. And so the scar will grow outwards internally, generally, and eventually it reaches something and it might stick onto something, which becomes an adhesion. So, for example, it could stick onto internal organs, or it could stick onto a nerve or something else. And so suddenly you've got something else that's compromised as well. So it sort of builds up over time. And so lots of people, actually, the issue is something that's not recent. It's happened
Mm.
in the past.
Gosh, well, I'm going to have a very selfish moment here, because I had a liver transplant 6 years ago due to an
Mm,
autoimmune disease. And when I first had it, had the operation, I was quite good at actually sort of, I have this kind of, it's like a claw, and I was massaging along the scar and
mm,
backwards and forward. I must say I got a little bit, I haven't done it for a while.
mm,
Now, the scar has kind of almost like spread a little bit where
mhm,
the opening is. Should I still be massaging it,
mhm,
still kind of giving it sort of care and attention, sort of
mm,
looking after that? I mean, because
yeah.
it could affect other parts of my body.
Yeah, I would say you should always massage scar tissue and massage it gently, but in all directions. And as you'll know your scar better than anyone else, and you'll feel where the scar tissue, you can actually feel the difference between where the scar, the surface scar is, and then outwards, there'll be a point at which it doesn't feel so much like scar tissue and it feels like ordinary
Yeah.
tissue. And so massaging to make sure that there's still that connection between the two types of tissue is really important. But also, whenever you massage from the surface in, you're helping the internal scar tissue. In fact, John Barnes, who I trained with in the States, he always says that a scar is just the tip of the fascial iceberg, and internally there can be all sorts of stuff going on.
Gosh, that's good, isn't it? Tip of the fascia iceberg. Wow. And you were saying that with well, first of all, let's stick with this and then we'll go back to hips and things. But
Mhm.
when you're actually, so you as a practitioner can
Mhm.
actually help someone by massaging and helping to release this fascia. And you said
Mhm.
also that it was possible for doing self-care. So can you therefore teach people how to massage bits of their fascia and stretch it out? Is it a case of stretching, or is it sort of manipulating and putting your fingers in?
Well, it's different things. So I'm a very big fan of self-help myofascial exercises. And because the more people do for themselves, the more it helps them. So it's great having a myofascial treatment, and most people come initially sort of once a week. So that's fantastic. But there's a lot of week in between each session. And so the more people can do for themselves, the better. And it also gives them something they can do ongoing. And I think the other thing is for a lot of people, particularly when they've had pain for a while, is they feel very unempowered. Um,
Mm.
and so this gives them their power back because they can actually do something for themselves. So the things that I teach every client and I teach everybody after even the first session to start doing some myofascial exercises. So the main things I teach are stretches and also using myofascial balls. And I've got one here. Let me just get it. So this is a myofascial ball.
Wow.
So I have sort of developed a myofascial kit for people to have and to use, because I also wrote a book about self-help treatment. So it's all sort of connected in. So these balls are good because they are inflatable. So they've got some give in them. So they're a bit bigger than a tennis ball. I mean, you can use any kind of ball, but these are a little bit more giving, particularly if you've got pain and things are sensitive. And they've got a valve on the back so you can pump them up or you can deflate them. So the idea with a ball or with a stretch is to do things very slowly and very progressively. So fascia is a very slow releasing tissue. And if you do things too quickly, it will tighten up in a reflex response to protect the body. So by using a ball or by doing a stretch very slowly and progressively and listening to your body, you can encourage the tissues to continue to release. And so, for example, a stretch, instead of doing a whole set of stretches that you might do if you went to the gym, you do one stretch, but you keep going and you just allow time for the body to start to release. And people really can start to feel things connecting again through the body as the tissues release.
Brilliant. Absolutely brilliant. And does it help if the flesh is warmed up, if you do it just after a shower or a bath? Does it make it more malleable?
It does. So the two things that fascia likes, it likes heat and it likes sustained pressure. So yes, if you've had a shower or a bath, or you've been for a walk or done something to warm your body up, then that's great. That really helps. The tissues naturally become more stretchy as they're warmer. And with these particular balls, because they're full of air, as you use them, they start to warm up a little bit as well because they're getting your body heat. So it all sort of helps to encourage the tissues to release.
Fantastic. And I love the fact that this is actually something that someone can actually take away and be doing, because I think,
Mm.
as you say, patients can feel hugely unempowered, and after chunks of time where they've been told, oh no, there's nothing wrong with you, no, we can't find anything, and
Yeah,
they know something's wrong and they can feel the pain.
yeah.
And pain, it's a message, isn't it, from the body telling you that something's not right and needs to be somehow changed or affected, doesn't it? So is that what
Yeah.
pain?
Yeah, I mean that basically is what pain is about, is that something is not right. And a lot of people, again, they tend to sort of feel niggles.
Mm,
The niggle sort of is there for a while, might get sort of sore neck, and then it goes away. And then they may get another niggle and that goes away. And eventually they get a pain that won't go away. And it's kind of like things have built up, because each time you get a niggle, your body adjusts to accommodate
yeah,
that. So you change the whole balance of your body, and that feels comfortable, and then that gets a bit tight. And so it's a bit like wearing tight clothes. When they're too tight, you sort of adjust yourself and it feels comfortable, but then after a bit, it starts feeling uncomfortable again. So it's exactly the same principle with fascial restrictions, that your body builds up layers of fascial restriction that can spread into different areas. And eventually it gets to a point where it goes, no, actually we can't do anything more. So we're going to give you pain because you've got to do something. And that's what most people. So again, when I treat people, we quite often go backwards through their pain history.
mm,
So they might come in with neck pain, and then that starts to resolve, and then their body focuses on whatever was number two. And
yeah,
so then it goes into the shoulder, and then we might go into their hip and then their foot. So we can quite often travel all the way around the body and eventually get back to something that they recognize was the original injury or whatever. So it's always a very interesting journey for people.
fascinating, absolutely fascinating.
Mm.
Because I think that is the case, isn't it? You have backache or shoulder ache or something, and you'll do all the massages and you'll put like a hot compress on and things, but it'll come back because actually the challenge is somewhere else on your body that's actually pulling and creating this disturbance.
Mm.
So when someone comes into you take sort of their patient's story, so to speak,
Mm.
that thing you kind of see how that do you look at how they're standing, or how they
Yeah.
move? Do you read them?
Yeah, so it's a sort of combination of things. So obviously there's the history, there's looking at them posturally to see how they stand and how they hold themselves. There'll be also sometimes how they walk or how they can move different bits of the body or not move them, depending on the restrictions. And also importantly, sort of what sort of things they do or have done in terms of work and exercise. And so that sort of builds a whole history, and that gives a good starting point of where to start to treat.
Brilliant, absolutely brilliant. And so you created these balls, and you said you also wrote a book, is that correct?
Yeah, yeah, two
Brilliant.
books actually.
Oh,
So
and what are they called, and where can people find them?
the main one is called Living Pain Free, Healing Chronic Pain with Myofascial Release. And that's on, you can get that on my website and also on Amazon.
Excellent. Super. And so that's two books, sorry, Living Pain Free, and the other one was
No, so that's all one book. The other book is called Trigger Points. What's it? Use the power of touch to live life pain free. I think it's the, if I remember it rightly, yes. So it's more about trigger point, but trigger points are restrictions in fascia. So it's another way of, so it's fascia and muscle, the soft tissues in the body, when they get stuck and you get into what feels like knots in your tissues,
yes.
that's a trigger point. And so again, like they basically are the same thing, fascial restrictions and trigger points. So if you press on a trigger point, you'll get pain either where it is, or it will refer pain to elsewhere in the body.
Amazing.
So both, yeah.
There's like a magic place that you can sort of press or put some positioning in there.
Yeah, it's not so much magic as it was actually mapped out. There was a Dr. Janet Travell in the 1960s. She was actually JFK's physician, and she mapped out the trigger points for the entire body. And I mean, she's got two. The books are like, this big, and there's an upper body and a lower body one, and so there's very, very detailed. And so as a basis for treating people, it's very helpful to know where trigger points are, because it's very typical. If somebody sort of says, I get this sort of burning pain sort of in my shoulder blade, then you know which muscles are involved, and so that's a good starting point for working with people.
And what led you into this specific focus? Because you said you were in massage and then you came over to the myofascial focus.
Yeah, so actually before that, I spent about 20 years working in business and doing a lot of sports, and I didn't do not much stretching. So I didn't really look after myself, but did a lot of sport. And eventually I had a prolapsed disc in my back, which I had to have surgery for. And that helped initially, got rid of the pain, but then some of the pain came back. And it was actually the scar tissue from the surgery that was continuing to cause the pain. So at that point, it was a sort of a combination of thinking I need to do something different and getting some treatment that led me to retrain in massage therapy and then sports massage therapy. And very, very early on, after I qualified, I happened to do some courses that had some myofascial release in them, and that just made so much sense to me. So I then did all the courses I could find in the UK, and then went to the States to train with John Barnes. So I've been over there a few times, and he is one of the earlier sort of proponents of myofascial release. He's still going strong. I think he must be in at least his mid-80s by now, still teaching, and it's sort of formed the basis of what I do now.
Oh, fantastic. Oh, I love it. I mean, it's not crucially necessary to, why someone does what they does, but it's always so inspiring to hear that someone has actually come into one of these disciplines because they've been someone who's experienced what it's like to be in pain and to be on the other side of the fence, so to speak. Because I think often when people go and they see a doctor or a practitioner, you can explain your symptoms, but you know that on the whole they won't have gone through it and they won't know what it's like. And so actually to feel like you're on the same team is brilliant. And so you've written these books, you've created these balls, and you offer your one-on-one service. Have you got future plans to write anything else or create any more products, or do you feel that you've now got out into the world what needs to be shared?
I'm always thinking of new things. I mean, at the moment, I have developed and launched courses to teach therapists myofascial release, mainly because I get a lot of calls and emails from people who are looking for myofascial release therapists in the UK. And there's not many of us around. There's lots of people who've done a little bit of training in it, and not many people who specialize. So I develop courses so that people can actually train with me, and now I've got quite a few people around the country, which is great. So I can actually refer people on. And that's sort of really sort of continuing to do that. I also have a YouTube channel, so I'm always doing videos. So that's for anybody of self-help exercises. So they are all on there for anybody who wants to have a look.
Brilliant. Oh, well, and thank you for creating those courses to train others, because I mean, there are so many people who are in pain and who are feeling so disheartened, because as much as the NHS is wonderful in terms of so many aspects, when it comes to the invisible things that they can't show on scans or come up in tests, it's when this sort of technique practice can actually really be so life-changing. And so more people doing it is absolutely brilliant. Brilliant, brilliant, brilliant.
Yeah.
Oh, well, is there anything else that you'd like to share with our listeners today?
I don't think so. I think the main message I always want to get over to people is to look after your fascia and to do, if you do regular stretching and regular exercise, you can, I know plenty of people have got themselves out of pain with
Hello, Amanda, can you still hear me? I think we might have lost her there. Amanda? Well, let's see if we can get her back. But that was just incredibly insightful. And well, as you could hear, pain doesn't mean forever. Actually, there are alternatives to the normal channels that you can investigate. So what I will do is I will get links to her website, her YouTube videos, and all of her products and things, and I will pop them on the show notes, and then you will be able to access them. Thank you so much for listening to this interview. I'm sorry that we lost her for some reason, but as you can tell, she's absolutely fantastic and a real blessing to have had this communication with her today.